The World Health Organization officially recommended the use of a second malaria vaccine to curb the life-threatening disease spread to humans by some mosquitoes, anticipating record demand from African countries. 2023 has been a decisive year in the fight against malaria. After 20 years of progress, malaria research has been at a standstill since 2020. But the deployment of the serums promises to turn the tide, at least for now. Many experts say it is time to end the killer disease once and for all. But how long will that take? Here's a report.
A plane carrying a batch of the world's first vaccine against malaria touched down at Yaoundé International Airport in Cameroon at the end of November. The United Nations has commended the forthcoming scale-up of malaria vaccination across Africa expected after the arrival of the vaccine. Since 2019, more than 2 million children have been vaccinated in Ghana, Kenya and Malawi in a pilot phase, resulting in substantial reductions in severe malaria illness and hospitalizations. Now, the scheme is moving into a broader rollout with the arrival of 331,200 doses of RTSS, the malaria vaccine recommended by the UN's World Health Organization. The delivery, which signals the scale-up of vaccination against malaria across the highest risk areas on the African continent, will begin shortly.
Today, it gives me great pleasure to announce that WHO is recommending a second vaccine called R21-Matrix-M to prevent malaria in children at risk of the disease. As a malaria researcher, I used to dream of the day when we would have a safe and effective vaccine against malaria. Now we have two.
But malaria is on the rise, according to the 2023 World Malaria Report. An array of factors, including drug resistance, climate change, and humanitarian crisis, contributed to some 249 million cases of malaria last year, a rise from 223 million cases 3 years before the start of the COVID pandemic, which also helped increase cases. One of the biggest threats, according to the report, is climate change. Rising temperatures, increased humidity and rainfall can influence the behavior and survival of the malaria-carrying Anopheles mosquito. Increased heat waves and flooding due to extreme weather can also increase the chance of transmission.
With climate change, the mosquito season is becoming longer. Even now in November, we still can find mosquitoes in temperate areas where mosquitoes didn't used to be common this late in the year. This is important as the season for mosquito-borne diseases is also extended. Also, some mosquitoes are being found in more northern latitudes than where they used to be found. A good example is a persistent population of Aedes aegypti, a mosquito transmitting dengue, Zika, and chikungunya that has been persistently found in Washington, D.C.
Kenya expanded the use of the world's first malaria vaccine in the lake endemic region, where malaria kills many children under 5. In 2021, the World Health Organization recommended the RTSS malaria vaccine for broader use after successful piloting in Kenya, Ghana and Malawi started in 2019. In May 2023, the World Health Organization hailed the distribution of the RTSS malaria vaccine, describing it as a real breakthrough in child health and child survival. But Catherine O'Brien, the organization's director for immunization, vaccines and biologicals, warns that despite this new tool, it's important to remember nearly every minute a child dies of malaria.
The supply is insufficient for all of the need. And so we're very much looking forward to the review of the second malaria vaccine through both our regulatory processes and our policy processes. And if that review of that evidence leads to recommendations, we would expect a significant increase in the supply in the quite short term.
Africa accounted for 95% of global malaria cases and 96% related deaths from the mosquito-borne disease in 2021. Yearly, global malaria deaths fell dramatically between 2000 and 2019, but shot up 10% in 2020 to 625,000 as the COVID-19 crisis hit protection and treatment efforts. Deaths dipped slightly to 619,000 in 2021. 77% were children aged under 5. Meanwhile, global malaria cases rose slightly to 247 million. The vaccine rollout is a breakthrough moment for malaria control and a ray of light in a dark time for so many vulnerable children in the world. But more work is needed to completely end Africa's second most lethal killer disease once and for all. Bureau Report, WION World is One.
WION is now available in your country. Download the app now and get all the news on the move.